For 30 years, the Catholic Charities Healthcare Network has enabled low-income and uninsured residents of the Archdiocese of Washington to receive needed specialty medical and dental services.
Cardinal Hickey, who was the founder of the network, had a great inspiration. He felt that we as Catholics serve the poor, not because the poor are Catholic, but because we are Catholic.
Cardinal Hickey began the network when he learned the terrible situation for the indigent, the poor, the homeless in the city, that they could not get specialized medical care.
So we called together three of our members, Dr. Curtin, Dr. John Collins Harvey, and also Dr. Edmund Pellegrino. And he called them together to share his vision, to seek their support, to enlist names of doctors and nurses who would be of help. 1 month later, 30 years ago this year, the Cardinal sent a letter out to do precisely that.
Our patients describe how receiving this specialty medical care really enables them to work again, to live without pain, and to live without worrying about huge medical bills.
It's important for the doctors community to volunteer for working in the network because we have no money to pay anyone, so we need volunteers. But also, it gives all the physicians, Catholic and non-Catholic physicians of any faith, to express their opportunity to take care of the poor and the destitute in our community. That's why the Archdiocese Healthcare Network has been developed.
The John Carroll Society, through its vast network of professional men and women in our community, are encouraged by the leadership of John Carroll to, particularly the doctors in this case, to exercise their ministry as medical professionals to the poorest of the poor. So we are the arms and legs, if you will, of this dimension of Catholic Charities in our effort to find those who will volunteer to do this very, very significant work for the poor.
Healthcare providers should volunteer with the healthcare network if they believe that having a healthy body promotes success and contributes to the dignity of a human being.
And the John Carroll Society and its committee, it's been changed over the years, of course, but always the presidents and Monsignor Vaghi have been with us right from the beginning and have taken care of a lot of the things that the healthcare workers should not be burdened with in that sense because they're administrative activities. And it works out very well, and we're so happy with this relationship.
The John Carroll Society has always been a valued supporter of the healthcare network. Not only do they aid in recruitment of new volunteers, they also put on the annual Rose Mass, which is really a beautiful recognition of the calling of medical professionals.
From the very first day that I met Cardinal Wuerl, then Archbishop Wuerl, he knew of the John Carroll Society. He knew of our many, many, many works. And in a special way, because of his own love for the poor, he has been very supportive, not only of the healthcare network, but of the legal network. The network has prospered, it continues to grow, and with the help of all here, and many, many in following years, it will continue to fulfill the vision of Cardinal Hickey.